My name's Tim. I'm a cancer researcher, and I had radiotherapy in 2012 for prostate cancer. I've had a varied career, but the focus was mainly on drug development, and later in my career I finished off with clinical trials, first into man drugs. The first indication that something was wrong was when my prostate collapsed, and I was on my way back from a meeting in London, and so I was stuck on a train for 2.5 hours with not being able to pass urine and in agony. And this followed on through various sort of going to the A&E and the GP, and eventually to a urologist who diagnosed me with prostate cancer. It wasn't too much of a surprise because I sort of had a guess what was going to going on there. But it was really a bit of a shock because it immediately brought up sort of memories of my father who died of lung cancer. And of course, my brother also had died of lung cancer, both of them under 60, and I was 58. So it was a bit of, oh, it's my turn now. And that's how I felt at the time. It was a very bad prognosis. It was a bad prostate cancer. So surgery wasn't an option, and I was going to go on to hormone therapy. I really wanted to have radiotherapy, but I had to wait a whole year because there was a 70% chance that my cancer would spread. And radiotherapy wouldn't benefit me. When it actually came to having radiotherapy, however, it was slightly different. I was very apprehensive because the reality of the fact that, yeah, I have cancer, they're now treating it. So it was a mixture of relief, but apprehension, because that really is very sobering, that they're now treating me for my cancer. And when you cross over from research to patient, it's a bleak landscape you find, and it's quite scary, very scary. For all your knowledge and experience, here you are now a patient, actually completely dependent on the medical staff to treat your disease, because you can't personally do anything about that at all. The day I actually started radiotherapy, they took me in, showed me the room, and it was very relaxed, they were very kind. And it's painless, you don't feel anything at all. You know, the machine whirs, and that's it, you're done. But of course, I had to have 37 fractions, which is 37 sessions. And so it got to be a bit like clocking in, clocking out, clocking in, clocking out. But it was very relaxed and easy. Whilst I was going through my therapy, I'd used social media, had a tablet, which I'd bought, treated myself to a tablet. And I used this to sort of tell my friends how I felt. And if I felt down, I didn't go into detail, I'd just say, I'm having a down day today. And I'd get a flood of replies from people just bolstering me, and that was really, really good. In addition, of course, to my family, who were very, very supportive. The short-term side effects cleared up quite quickly, which they do in the majority of patients. There is a very small chance that you have more severe side effects or later side effects, which is what happened to me. And after about 3 months, I started bleeding from my back passage, a little bit at first, and then it got steadily worse and worse. This is a known side effect for pelvic radiation, and I then had to see another specialist to check it out to make sure it wasn't another cancer. Finding support for side effects and living with and beyond cancer can be very challenging, and that was one of the reasons why I became proactive as a patient advocate, and I became a member, a trustee of the Pelvic Radiation Disease Association, which I have been for the last 6 years now. We have a national voice supporting patients who are trying to find the right avenues for help with their problems, and informing other healthcare professionals and charities about this issue, and keeping this issue afloat in the terms of medical support. At the time I had my treatment, I had 2 daughters and 1 granddaughter who was 10 years old. Now I have 6 grandchildren, and I firmly believe that the radiotherapy gave me that extra time to see them born, and is still giving me extra time to see them grow up. Despite all the issues I had with side effects following my radiotherapy and these late effects, I still find that I've got a good quality of life, that I can live with my family, you know, and enjoy my grandchildren. So after I'd finished my radiotherapy, I decided, like a lot of patients do, I was going to go and do a charity run. I was going to do a 10K. a Manchester 10K. So I started training on my own, running around the park and things like this, and eventually joined a running club. And I got hooked on it. After the first 10K, I thought, this is really good. All the cheers of the crowd and such things. So I carried on running and running and running. And my daughter is a runner, so that gave me an extra connection to her as well, something we could talk about. And eventually, I ended up in 2016 running a marathon, which I would never have thought of doing. And I felt healthier and fitter than I'd ever felt, despite the fact I had cancer. My advice to anybody who's about to start radiotherapy is, as an informed patient, I would say, do your homework, ask the questions. Don't be afraid to ask the questions of the experts, not Dr. Google. I would suggest to any other patient to get involved in research, and the scientists themselves will benefit from your input, and they want your input. It's important to them. And the evidence is that patients who are involved in research do indeed do well. So my dad was diagnosed with lung cancer in the 70s when I was at university. So in the 70s, everything was cool, and the Magic Roundabout was very popular. So I had this little sort of cereal box, Florence. So I gave it to my dad, and I said, oh, you can make that into a cool necklace. So he just drove a nail into the head and fixed the chain in. And I said, well, you can keep that. And he did. He kept it by his bedside locker all the time. I actually took it with me when I went to radiotherapy.